absolutely appropriate to go there.
If you've ever had to visit a hospital emergency department, you've likely discovered that it can take a long time to be seen. Now, new data obtained exclusively by the Herald reveals exactly what's going on when it comes to patient triage scores. That's the recommended time frame within which you should be seen. The results paint a worrying picture. All of the country's EDs are failing to meet key standards. Official information reveals that in the first 6 months of last year, more than 300,000 patients around New Zealand who turned up in an imminently or potentially life-threatening condition were not seen in a clinically appropriate time. Is that a concern?
It's really concerning data, and as we have to do better. It is showing a system under intense pressure, and it's showing a whole system under pressure.
Is it showing a system failing?
By the numbers you're telling me, it is showing a system that is failing.
Kate Allen has been an emergency medicine physician for almost 20 years and is the New Zealand chair of the Australasian College of Emergency Medicine.
We're not delivering the care we need to our patients. And what we need from our ministers and our government is to listen to the clinicians in the front line or on the floor, and we need to all work together to work out what is the best solutions. There are no simple answers, but we need to work out how we can do this better to ensure that those who need emergency care are getting it in the time that they need to get it.
Because if they don't, is it the case that their condition could either rapidly worsen and they could end up being in hospital for longer, or at the really sharp end, they could die?
Yeah, if we don't, the spectrum's like this. One end is death, at one end they're absolutely fine.
On arrival at any ED, you'll be assessed into a category. Category 1 are those in immediately life-threatening situations, like, for example, a patient in cardiac arrest, and they should be seen immediately. 2 is an imminently life-threatening situation, and 3 is potentially life-threatening. Category 4 is classified as potentially serious, and 5 is less urgent. Health New Zealand says it's rare that the most urgent Category 1 patients are not seen immediately. So, focusing on Category 2 and 3 patients, those patients should be seen in 10 minutes and 30 minutes respectively. None of our EDs get close to hitting those targets, and that means more than 300,000 Category 2 and 3 patients didn't get the care they should have.
It's a massive problem. So one of the key issues is that staffing levels have not been increased to match acute demand or even population growth. So it's a massive problem. It creates real risk, and it also adds to burnout for the staff who are in there trying to manage.
How would you describe how we're performing as a country at the moment?
If it was NCA, it would be not achieved, right? It's impossible for us to meet those triage times in a meaningful way with overcrowded hospitals, inadequate community facilities, and an ongoing refusal by Te Whatu Ora to staff appropriately.
She says her union regularly does audits to assess the current numbers of staff against the demand.
We do it all the time. It's a standard activity that our union does to try and support our members. They are routinely ignored. But increasingly under Te Whatu Ora, decision-making has moved further and further and further up the hierarchy, so it's almost impossible to get anything done.
Analysis by the Herald of the data reveals the top 5 worst performing emergency departments, with Wairarapa ED topping the list. 88.9% of patients in Category 2 to 5 are not seen on time in that ED. It's followed by Palmerston North, Auckland City, North Shore and Middlemore. Again, the vast majority of patients arriving at these EDs won't be seen in time. Te Kuiti, Gisborne and Taumaranui ED is where you'll still face delays, but they are the best performers in terms of seeing patients in the recommended timeframes.
As you have shown in that data, you are probably going to be waiting a long time. And, that is the new normal of presenting at an emergency department, unless you are very, very likely to die imminently, you are likely to be sitting there for a very long time. And that speaks to failures across the health system.
Dalton says it's not just a lack of staff that's contributing to overburdened EDs.
And it speaks to community-based staffing and resource shortages as well. We don't have enough GPs. We don't have enough GPs in the right places. We don't have enough docs in our hospitals. People have to wait too long for planned care. You get bed-blocked hospitals where you can't discharge patients out of wards, which means there's no room in the wards to admit people from the emergency department. So that's a problem.
In Parliament, the health crisis is regularly raised, with both sides bickering and blaming each other.
And what we need to hear from this government is a clear plan and where they're taking our health sector. Because right now, we have workforce right up and down this country extremely unhappy in their roles. We have a health sector that are told that they cannot actually hire more people despite being clearly stressed in their job.
They are the ones who decided to restructure our health system during the middle of a pandemic. So stop lecturing and have a look in the mirror as to what the decisions you made, that opposition made, when they were last in government.
Do politicians need to listen to the front line?
I think they definitely need to listen to clinicians that are delivering care to the patients on every level.
Do you feel like that's happening?
Not all the time.
That must be concerning and frustrating for you and your colleagues.
Yeah, it is a challenging time in health, but it's a challenging time because there has been so much change and so much uncertainty, and that is continuing. And I don't anticipate it's going to suddenly get better soon. And when you're unable to deliver care or you see harm happen, that is where it gets really, really challenging. And when you're buffering a system that just feels broken, that can be really challenging.
When you say challenging, what do you mean exactly? Emotionally draining?
Exhausting.